morning, Mr. Osborne. I'm PFC Layatwin. The doctor has ordered an IV for you today. Have you ever had an IV before?
No, I haven't.
I'm going to gather my equipment, and when I come back, I'll explain the procedure to you. Do you have any questions?
No, I don't.
I'll be right back.
An IV can prevent shock, replace lost fluids, or provide medication that a patient may be unable to take by mouth. We are now going to explain the proper way to initiate an intravenous infusion. Before you begin the procedure, you will need to wash your hands. Check the physician's order. You will need an IV solution bag, an IV infusion set, an over-the-needle catheter unit, tape, a constriction band, a sterile dressing, which could be sterile 2x2 gauze, or an opsite dressing, antiseptic sponges, gloves, underpad, basin, and labels. Before starting the IV, be sure to check the solution. Look at the expiration date to be sure you are not using outdated solution. Be sure the fluid is clear and has no particles visible. Check for leaks by squeezing the bag. If you do find a leak, throw the solution away. It is no longer sterile. Check to see that you have the correct amount of solution. Check the IV infusion set package for tears. Now take the infusion set out of the box and look for discoloration, holes, and cracks. Remember, if there is any possibility of contamination or damage, contact a supervisor and throw the package away and get a new one. Don't take any chances. Now, move the clamp on the tubing to approximately 6 to 8 inches from the drip chamber. Tighten the clamp. Uncap the spike of the IV infusion set. Remove the cover from the outlet port on the bag. Be sure they don't touch anything before they're connected. Insert the spike into the port with one quick twisting motion. Hang the bag on the IV pole. It needs to be above the level of the patient's heart. Squeeze the drip chamber until it is half full. It is critical that you remove the air from the tubing at this point to prevent air embolism. To do so, hold the tubing over a clean basin. Loosen the protective cover on the end of the infusion set. Open the clamp on the tubing, allowing the fluid to flow slowly until it reaches the end of the infusion set, removing all the air. Reclamp the tubing and retighten the protective cover on the infusion set. Loop the tubing over the IV stand. Open the sterile gauze. Tear strips of tape and hang them on something you can easily get to. Now that you have prepared your equipment, the next step is to identify the patient, explain the procedure, and get any information you need.
Do you have any allergies that you know of?
No, not that I know of.
Are you allergic to betadine?
No.
As you know, the doctor has ordered an IV. It is a two-part catheter needle. The needle is for introduction of the catheter into the vein. The needle will be removed once the catheter has been advanced into the vein. You might experience some slight discomfort as we're inserting it. But once the catheter is in place, there should be no pain. Once we have the IV in, try not to move around too much or touch the equipment. Do you have any questions?
No.
Okay, let's get started then.
Now you're ready to select the infusion site. Select a vein as close to the end of the extremity as possible. The preferred site would be the hand or arm. Avoid veins in areas which are infected, injured, or irritated. You will now prepare the infusion site. First, apply the constriction band 5 to 6 inches above the site. Remember, the constriction band should not remain in place more than 2 minutes. Ask the patient to open and close his fist. Look and palpate for a suitable vein. Clean the area with an antiseptic sponge. Use a circular motion moving from the center out for several inches. Be sure you do not contaminate the section of skin that you have cleaned. Loosen the cap at the end of the IV tubing. Bring the tubing close to the insertion site. At this point, put on protective gloves. Remove the catheter from the package. Remove the protective cover from the catheter, being careful not to contaminate the needle. Check the needle for burrs and nicks. The bevel should be smooth. Loosen the catheter from the needle. Pull the skin below the site until it is taut. Be sure the bevel of the needle is facing up. Position the needle at about a 20 to 30 degree angle. And enter the skin gently, slightly to the side or the top of the vein. You will feel a give when the needle actually enters the vein. You should see blood in the flash chamber. If during the procedure the catheter did not go into the vein correctly, release the constriction band. Pull the catheter out, apply pressure, and bandage the site. If the catheter did go into the vein, lower it until it is almost parallel to the skin surface. Stabilize the flash chamber. Holding the catheter hub, advance the catheter into the vein to the hub without contaminating the catheter. Remove the needle from the catheter. While continuing to hold the catheter hub, use a finger to press lightly on the skin above the catheter tip. Release the constriction band. Once you have removed the needle, do not reinsert it into the catheter. Remove the protective cover from the tubing and connect the tubing quickly and tightly into the catheter hub. Release the clamp on the IV tubing to allow the fluid to drip slowly. If at any point pain or swelling occur at the site, stop the infusion. You may need to clean blood from around the site. Now you are ready to secure the catheter. Tape the hub to the skin, being sure to leave the hub and the tubing connection visible. Once the catheter is secure, place a sterile dressing over the site. and tape it in place. Make a loose safety loop and secure it with tape. If you are following a physician's order, regulate the IV flow rate accordingly. Label the site with the date, the time, the gauge of the catheter, and your initials. Label the tubing with the date and the time. Also label the bag with the date and the time. Document the procedure on the patient's record. And then clean up. When you have completed the procedure, wash your hands. If at any point throughout the procedure you have problems or questions, check with the nurse. IVs may be a time-consuming project, but you will find the acquisition of this new skill to be an invaluable one, a skill which will enable you to prevent shock and save lives.